And today we're going to talk about 5 amazing teas to combat poor circulation, varicose veins, and leg pain. So, have you ever wondered if these teas could help you improve your circulation? So, if you have any heart issues, arterial thrombosis, high blood pressure, or any other condition that affects the cardiovascular system, this video will be very helpful. But first, how do you know if you have poor circulation? What are the most common signs and symptoms of poor circulation? Well, folks, the signs and symptoms of poor circulation are diverse. So it could be a feeling of tired legs, that person who feels weighted, fatigue in the legs, mainly after long periods of standing or sitting, that person experiencing pain in the legs, especially in the calves, a pain that worsens with walking and eases with rest, which we also call intermittent claudication, or if someone has tingling numbness, pins and needles in the legs, swelling, varicose veins, pale or discolored skin, ulcers that are hard to heal, weak hair and nails, cold extremities, difficulty healing a wound, muscle cramps due to lack of oxygen. So all of this, folks, is a clinical manifestation of poor circulation. Obviously, they can also be clinical manifestations of other diseases. However, if you feel any of these symptoms, and I just told you, this video is perfect for you, and you have nothing to lose by staying till the end, because we are about to discuss here which are the best teas to improve to combat poor circulation. The 5th tea that is good for circulation is ginger tea, mainly because it contains 2 vasodilating substances, gingerol and gigal. Moreover, ginger also has anti-inflammatory properties. And we always say here that chronic inflammation harms blood vessels and affects circulation. More than that, ginger also has antioxidants that fight free radicals, which fight oxidative stress, which is also beneficial for circulation and can reduce LDL cholesterol, which is the cholesterol that accumulates in our arteries and impairs our circulation. So by reducing LDL cholesterol levels, ginger can also reduce the risks of atherosclerosis, which is the buildup of cholesterol plaque, fat, calcium, and other waste products in our arteries. Who should avoid ginger? Anyone with allergies. Anyone who has any gastrointestinal problems, such as acid reflux, when consuming ginger. Anyone close to surgery because of ginger's influence on coagulation should also discontinue using ginger. Women who are pregnant, it is interesting to consult the doctor, even though we have several studies showing the safety of ginger during pregnancy, especially for the control of nausea. Still, at this stage of life, always interesting to consult the doctor, to err on the side of excess and not on the side of lack. And then that question always comes up, doctor, the person with high blood pressure, can they take ginger? Because I once heard that ginger increases blood pressure. Guys, those with high blood pressure not only can, but should consume ginger, because ginger helps to control high blood pressure, okay? And as I mentioned, for pregnant women, ginger is excellent for nausea. It's my favorite nausea medication, all right? For me, it's better than metoclopramide, than Plasil. It's better than Digizan, which is bromopride. It's better than Vonal, which is a Dancentron. For me, ginger tea is the best remedy for motion sickness. That's for me, Dr. John. For you, it might be different. Guys, the 4th tea is turmeric tea, okay? Because turmeric tea contains curcuminoids, especially curcumin, which are potent anti-inflammatories and antioxidants, capable of even improving our endothelial function. The endothelium is the wall that internally lines our blood vessels, and it controls multiple functions. It dictates when the vessel will dilate and when it will contract. So it's very crucial for us to keep our endothelial function in check. And turmeric greatly assists with this, not to mention it also reduces LDL, akin to ginger. So it helps prevent atherosclerosis, it combats oxidative stress, and it also fights inflammation, not to mention that it can have a significant effect on blood pressure. It can have a noteworthy effect on blood sugar control. So high blood pressure and hyperglycemia, right? Very high blood sugar are conditions that worsen circulation, so turmeric can be really helpful with this. One tip with turmeric is that its bioavailability isn't that high, so it's poorly absorbed in our body. And how do we tackle this problem? We take turmeric, we consume turmeric, coupled with piperine, which is black pepper. So making a tea with turmeric and black pepper is a fantastic combo, all right? The only warning here is for pregnant women and individuals using coumarin anticoagulants like Maravion, which is warfarin, to be careful with turmeric usage since it can interact with this medication, okay? And people, that's how it is. How am I going to prepare the tea? All teas are prepared in the same way. You're going to get the ingredient, you're going to get the ginger, you're going to get the turmeric, you're going to boil the water. When the water boils, you're going to add the ginger, or you're going to add the turmeric, or you're going to add the rest of the teas that I'm going to talk about here. You're going to let it steep for 5, 6, 7 minutes, covered for infusion, and then you're going to let it cool down and drink. So folks, there's no secret to making tea. People ask, what's the recipe for making tea? To me, asking for a tea recipe is the same thing as asking for a recipe to make ice, guys. Making tea does not, it's always the same, okay? Our 3rd tea here, which will help with your circulation, is hibiscus tea, rich in flavonoids such as quercetin, which is an excellent antimicrobial, antiviral, anti-inflammatory, antioxidant, vasodilator. Also, hibiscus tea is rich in anthocyanins, which are substances very present in red fruits. Perhaps it's for this reason hibiscus tea has its wonderful pink color. Hibiscus tea really has a beautiful color. It's probably because of precisely the anthocyanins, which are also present in strawberries, raspberries, blueberries. They also have anti-inflammatory, antioxidant, and vasodilator properties. And for this reason, hibiscus tea is a great option for reducing blood pressure. So it's very good at controlling hypertension, and so it can improve circulation. The ideal dose for consuming hibiscus tea is 1 to 2 cups per day. And you need to be careful because it can interact with blood pressure medications and also with diabetes. And it also has a diuretic effect. So drinking it too close to bedtime can make you get up many times to urinate during the night. And this can end up disrupting your sleep. All right? And side effects are very rare. And probably not. you might experience mild gastrointestinal discomfort. But if you have 1 cup, 2 cups of hibiscus tea, it's not going to do any harm. Our second tea is rosemary tea, which is rich in rosmarinic acid and also caffeic acid, substances that have vasodilatory properties, which relax our blood vessels, providing more room for blood to flow, and for this reason, improving blood circulation and also blood flow. Rosemary tea also helps to reduce blood glucose, and we know that hyperglycemic conditions like prediabetes or diabetes, they end up inflaming our blood vessels, generating oxidative stress to our blood vessels, and damaging these structures, worsening our circulation. Be very careful when using rosemary with common anticoagulants, such as warfarin. So, have you noticed here that warfarin Maravan, you have to be careful when you're going to take anything, even to eat cabbage, you have to be careful if you take Maravan, okay? Our first tea, and this one is sensational, is garlic tea. Well, folks, garlic tea is rich in allicin and adjoin, substances that help reduce blood viscosity, favoring circulation, and preventing the formation of clots. More than that, garlic is also excellent for controlling blood pressure and also for helping to control your blood sugar. The ideal consumption of garlic is around 2 to 4 grams per day, and it's ideal to consume the garlic tea in the morning. You can crush some of the garlic. I think it's even better to crush the garlic and add it to the tea rather than using the whole garlic, because when the garlic is crushed, it releases more allicin. So it's worth it for you to crush the garlic, add this crushed garlic to an infusion, and drink it, okay? You can even strain it, or you can swallow it along with the whole garlic, all right? And again, be careful with coumarin anticoagulants, as they can interact with garlic. Guys, these teas can greatly aid in combating poor circulation because they will help you control your blood pressure, they will help control diabetes, they will reduce inflammation in your body, reduce your body's oxidative stress. Like it or not, they will hydrate you and make you consume more fluids, which is also essential to combat poor circulation. However, you can't expect that drinking 1 cup of tea a day will solve the problem of poor circulation. Why? Poor circulation is a multifactorial problem. So why does a person have poor circulation? Typically, it's because they smoke, because they're overweight, because they have high blood pressure, because they're diabetic, because they have high cholesterol, because they're sedentary. So we can't assume that drinking 1 cup of tea a day will fix it all. Firstly, the tea won't make you stop being sedentary. The tea won't make you quit smoking. The tea won't cure your diabetes, your high blood pressure, or your high cholesterol. That's just not how it works, folks. The tea won't do that. The tea will help, but it's just the icing on the cake. If you have circulation issues, you need to maintain a healthy weight, refrain from drinking, quit smoking, eat well, sleep well, manage your stress and anxiety, and exercise. All of these are crucial to improving your circulation. So if you want the entire guide, the step-by-step, a complete step-by-step to have the best lifestyle in the world, the healthiest lifestyle in the world, I recommend you to read my book, The Longevity Code, No Habits to Exceed 100 Years. Because putting into practice the guidelines that are in the book, you will improve your control of blood pressure, diabetes, weight, cholesterol, and consequently, you will improve your circulation. So, do the following. Click now on the first link in the description or on the pinned link in the comments and acquire your longevity code right now. I am so sure that you will read the book and you will enjoy the book that I give you an unconditional guarantee of satisfaction. What does that mean? That if you read the book and you don't like it, you can ask for a refund and the money will be returned without questions and without bureaucracy. I do this because I am sure that you will get good use out of the book.